This Good Morning Washington Spotlight on Your Health is sponsored by George Washington University Hospital.
We're continuing our spotlight on health. And this morning we're joined by Dr. Zachary Levine, professor of neurosurgery at George Washington University Hospital. Welcome to Good Morning Washington.
Thank you.
So tell me everything that you do at the hospital and the work that you specialize in.
So I'm specifically working in the intraoperative MRI, doing something called focused ultrasound, which is a brand new way of treating people with tremor and Parkinson's disease. And we're the only hospital in the whole region that has this ability and this device.
So IMRI, explain that to me. I don't understand quite yet.
So an MRI, you know, is like an imaging device.
Yes.
So an intraoperative MRI is we've now coupled an operating room with the MRI so we can actually see what we're doing inside while we're operating and get results on the fly.
Yes.
So this is a more modern way of doing surgery. In particular, it's useful in brain surgery because we're working in this very sort of tight three-dimensional space. And for what I do, we actually use the MRI to guide exactly what we're doing down to measurements less than a millimeter.
Yeah. When you think about brain surgery and IMRI, that can be some scary stuff for some people to hear. What would you say to a patient or maybe a viewer who's watching right now who may be a little bit apprehensive about getting the procedure?
So for focused ultrasound, you are awake. There's no incision, and we are treating you and we're talking to you the whole time. And you're not sitting in the MRI like you would if you were going to get a scan from your doctor. We put you in there when we need you to be in there, we take you out, and the whole idea is that you know that your tremor, your symptoms are going to get better when the procedure's done. And sometimes you're only on the MRI table for about 20 minutes. So it's really quick, and you go home the same day.
Yeah.
So it's sort of a more sort of friendly, gentle way of doing surgery.
I like that because I feel like a lot of the anxiety and the nerves come that something's happening and you don't know about it because you're asleep. But if you're awake and you're hearing the doctors that you trust and prepared you for it as it's happening, that's got to be relieving.
And you actually get to see yourself get better. And there's no incision, so there's nothing to worry about afterwards. And then your tremor is gone. So you really, like most people, they can actually, while we're doing it, they'll take a drink of water and they say, wow, I can do that now. So it's pretty miraculous.
Like immediate. Wow, so what's next for neurosurgery?
So for the focused ultrasound, we're using it to treat brain tumors experimentally. We're doing it to diagnose brain tumors experimentally. There's a lot that's going to go on. This technology is very new, and there's only a few units all over the country. So we're trying to be on the forefront and, pardon the pun, the cutting edge of neurosurgery at George Washington.
And what all these new technologies and advancements you talk about give is hope.
Yes, it really does. These people get better right on the table. They're very happy, and it's very satisfying. What
message do you have for our viewers and any potential patients?
So I would say if you have essential tremor or Parkinson's disease where the tremor has really gone to the point where you're unable to do the things you wish to do, contact George Washington Hospital. We'll evaluate you and see if you're a good candidate.
Absolutely. Thank you for the work that you do and for also sharing all this information on Good Morning Washington.
Thanks for giving me the opportunity.
Appreciate it.